So I was 52 years old. I was in good shape. I had just completed a sprint triathlon 2 weeks before, and I was swimming across a lake in Idaho while I was on vacation with my husband's family. And I started having pain across my chest. I had this band of searing cold and pain. I couldn't breathe anymore. I was weak. And I was only halfway across the lake. And so I called my husband over. He was on a paddleboard nearby. And I climbed up on the paddleboard, and he rowed me the rest of the way back to the shore. But we got back to the house, and it was really confusing. We weren't sure what was happening. It was not on my radar that I was having a heart attack. By the next day, I was in a big hospital in Boise, Idaho, and in the cath lab, had an angiogram, and they diagnosed me with a condition that I'd never heard before, called a spontaneous coronary artery dissection. It was really frightening to know that I'd had a heart attack and that there wasn't much that I could do to have prevented it. The first thing I remember about meeting Molly was that she asked me, "Tell me the story of what happened to you." And I knew immediately that I was in the hands of a doctor who would treat me as a person with a life and a context in which this event had occurred, and not just as a diagnosis or an angiogram. It was such a scary time in my life and my family's life that I felt an enormous amount of relief knowing that I was in the hands of someone who was knowledgeable and an expert. So all the way through, I felt like I had a partner. I had somebody who understood what I wanted to do and what I wanted my life to be like. You remember when I told you I was going to make you an expert on SCAD?
I do. And I was excited because it isn't something that I knew much about. It's uncommon. And now that we know more about it, it turns out it's probably underdiagnosed. So it's been really interesting to see moving forward, as both you and I have raised awareness about this, that in our practice, we've identified some women, mostly, who have had this diagnosis. And I'm hopeful that that has moved them in a positive direction.
Well, I've listened to a lot of stories from a lot of other SCAD patients. At this point, I know a lot of other SCAD survivors, and I know that I'm one of the lucky ones, that not everybody has been as lucky as I have been to have a cardiologist who is really as collaborative and as thorough and as personal as you have been.
That's great to hear. Thank you.
It's been almost 3 years since my SCAD happened, and for quite a while I felt like I was seeing Molly every week or every couple of days sometimes. So she really hung in there with me while I went through a laundry list of medications and tests and assessments, and it really helped to figure out what was going on and what we could do to provide the best care for me. I don't see Molly as frequently now, which is fine, but I know that she's there, and I know if anything comes up that I can call her and she'll respond to me, and we'll get back to it and figure out what comes next. SCAD Alliance is a nonprofit organization that was started by a SCAD survivor, and the mission is to educate patients and physicians and advocate for patients as they move forward on their SCAD journey. Part of what I've tried to do since my SCAD is to develop some expertise on what the psychosocial consequences of SCAD are, what the experiences of patients are like, and understand more about how we can help people who have survived SCAD.